But the work is not over for healthcare workers and officials across the state. Today, I sat down with Boone County's Health Director, Stephanie Browning. She and her team are entering year 3 of this pandemic. She says their work goes on. Are you ready to call it just another flu?
Not yet.
As cases of COVID-19 decline, Boone County Health Director Stephanie Browning is optimistic but on guard. When is this over? When can I put my mask away for good?
Well, I think that is probably a decision everyone will make for themselves. I don't know when it's over. I think we're going to have COVID with us for a long time. Let's just hope it stays static.
The pandemic has left its mark on health departments and their leaders across the country. What would you say was the hardest part of this year 2?
For staff, it's just pure fatigue. Some in the public were getting very frustrated with the pandemic too, and sometimes they would lash out at our employees who were just trying to do their job.
Were your staff members and even you yourself, did you all deal with threats?
Couple, yeah, some that had police officers driving by my house on a regular basis.
As Browning and her team enter year 3 of the pandemic, they're trying to recover and maybe even rest. What do you hope for year 3?
I hope that the cases remain low. I hope that we never see the disruption that we saw in schools, in our healthcare systems, and our businesses. I hope all my employees get to take a vacation and not worry about COVID.
She hopes to repair some relationships in the community too.
Everybody would think that businesses were mad at Stephanie. Well, they weren't all mad at Stephanie. Now we have a whole lot of new partners that they want to work together on things because they realize that health and well-being and all of that is good for the bottom line.
When you say businesses want to work with you, what do you mean by that?
Stronger relationship, for example, with the chamber. Talking about workforce development, because one of the things that's very important in health is for people to have meaningful employment, right? And so how can we tie these things, these social determinants of health, how can we all work on them together?
Browning says despite the challenges of the last 2 years, she's here to stay. Can't scare you away that easy, huh?
No. I have developed a thick skin. That is for sure, a thicker skin. Yeah, still got a soft heart, but you just got to let things roll off your back sometimes.
Don't read the comment section.
No.